You retire at 60. Freedom. Then a bill arrives that nobody warned you about. Your health insurance. Unsubsidized. It runs about $24,000 a year for a couple. The meter starts the day you quit, and it runs for 5 years. Here's the answer before we start. The real cost of retiring early isn't your lifestyle. It's the gap. The 5 years between your last paycheck and Medicare at 65. In 2026, that gap got more expensive. But it's a system you can plan, not a surprise you suffer. Ignore it, and it can cost 6 figures. Plan it, and it shrinks. Not financial advice. Do your own math. Rung 1. Year 60. The sticker shock. For your whole career, your employer quietly paid most of your premium. That was a hidden subsidy. You just fired your sponsor. Now you buy your own plan on the open market. For a couple in their early 60s, the benchmark can top $24,000 a year. That's more expensive than a brand new car every single year, just to stay covered. End of year 1, $24,000 gone, and you haven't seen a doctor yet. Rung 2. Year 61. The cliff comes back. Until 2025, generous credits capped what most people paid. Those expired. For 2026, the old subsidy cliff returned. Earn $1 over the limit, and you lose every penny of help. For a couple, that limit sits near $84,000 of income. $1 over. Thousands in subsidy. Gone. Your taxable income now sets your premium. End of year 2, $48,000 spent, and your tax return just became a medical decision. Rung 3. Year 62. The tightrope. Early retirees live off savings. Every withdrawal creates taxable income. Convert to a Roth? Taxable income. Sell a winning fund? Taxable income. Push income up, and you fall off the cliff. Keep it too low, and you starve your own spending. Withdrawal order is no longer a tax question. It's a health insurance question. End of year 3, $72,000 spent, and you're doing algebra to buy aspirin. Rung 4. Years 63 and 64. The home stretch. The costs don't stand still. Premiums climb with age and inflation. By the finish line, a couple can spend well over $100,000 just bridging to Medicare. And here's the twist. Other countries price the same care at a fraction of the bill. Geography is a lever too. End of year 5, over $120,000 gone before Medicare even starts. Then you turn 65. Medicare begins. Relief. Except Medicare isn't free either. Fidelity estimates a 65-year-old couple will still spend about $345,000 on healthcare across retirement. The gap was just the opening act. So here's what actually matters. The gap is terrifying if you ignore it, and manageable if you plan it. Keep your taxable income under the cliff. Sequence your withdrawals on purpose. Use an HSA if you can. It's the only triple tax-free account you'll ever meet. And consider where you live. The number bends to a plan. To be fair, not everyone faces the full bill. Some keep a working spouse's plan. Some bridge 18 months on COBRA. Some deliberately live lean to qualify for subsidies. And Congress could restore the bigger credits. It's a live debate. Don't bet your retirement on it. So remember the real number. Retiring early doesn't just cost your salary. It costs the bridge to Medicare. 5 years, potentially 6 figures, and entirely plannable. The people who get burned are the ones who never ran the math. This isn't financial or insurance advice, just the public math. Run your own numbers and talk to a professional before you move real money. New working theory every night at 7. So tell me, what's your plan for the years between your last paycheck and Medicare?